Did you know that osteoporosis affects about 200 million women worldwide? That's more than the combined populations of Germany, France, and the United Kingdom. Today we're focusing on a critical issue that predominantly impacts women as they age: osteoporosis. Today we will discuss what osteoporosis is, why it's especially common in women, and the signs and symptoms to watch for. We'll also guide you through effective strategies for diagnosis, prevention, and management. Our goal is to heighten awareness and empower women with the knowledge to combat the silent progression of osteoporosis, fostering a proactive approach to bone health and wellness. Let's break down the science and myths surrounding this pervasive condition and learn how to safeguard our health for the future. Osteoporosis is a bone disease characterized by a decrease in bone mass and density, which can lead to an increased risk of fractures. This condition occurs when the creation of new bone doesn't keep up with the loss of old bone. Bones become weak and brittle to the extent that even mild stresses like bending over, lifting a vacuum cleaner, or coughing can cause a fracture. The most common fractures occur in the hip, wrist, and spine. Although it can affect both men and women, women are at a higher risk, particularly post-menopause, due to the sharp decline in estrogen, a hormone that helps maintain bone density. The causes of osteoporosis are multifactorial, including both biological and lifestyle factors. Biologically, decreased hormone levels in older age, especially reduced estrogen in women, play a significant role. Other contributing factors include a deficiency in calcium and vitamin D, a sedentary lifestyle, excessive alcohol consumption, and tobacco use. Genetics also plays a crucial role. A family history of osteoporosis can increase one's risk. Certain medications, such as some cancer medications and also glucocorticoid steroids, can also increase risk of developing osteoporosis. Globally, it's estimated that osteoporosis affects 200 million women, according to the International Osteoporosis Foundation. This staggering number highlights the importance of addressing this silent disease, as approximately 1 in 3 women over age 50 will experience osteoporotic fractures in their lifetime, underscoring the critical need for preventive measures and awareness. One of the most significant risk factors for osteoporosis in women is menopause, during which there is a marked decrease in estrogen levels. Estrogen is vital for maintaining bone density. Thus, when its levels drop, the rate of bone resorption accelerates while bone formation slows down, leading to an overall loss of bone mass. This hormonal change places postmenopausal women at a higher risk for osteoporosis and related fractures. Age also plays a crucial role in bone health. As both men and women grow older, bone density naturally decreases. This age-related decline is more pronounced in women, particularly after the age of 50, further increasing their risk of developing osteoporosis. Genetics, too, contributes significantly to the likelihood of developing osteoporosis. A family history of the disease can predispose individuals to lower bone density, which may be genetically inherited. Besides biological factors, lifestyle choices significantly impact bone health. Diets low in calcium and vitamin D impair bone density, while regular physical activity helps to strengthen bones. Conversely, smoking and excessive alcohol use have been linked to an increased risk of osteoporosis. Smoking reduces blood flow to the bones, decreases the absorption of calcium, and affects hormone levels necessary for bone health. Similarly, excessive alcohol interferes with the balance of calcium and the production of bone-forming cells. These lifestyle factors are crucially modifiable, offering women actionable ways to mitigate their risk of osteoporosis. Osteoporosis is often termed a silent disease because it can progress without any symptoms until a bone breaks. However, there are a few early signs that might suggest bone loss, such as a gradual loss of height or a noticeable change in posture, such as becoming stooped or hunched. Some may also experience back pain, which can be caused by a fractured or collapsed vertebra. As the disease progresses, the symptoms become more apparent and severe. The bones become increasingly brittle and fragile, leading to a higher risk of fractures even from minor falls, or, in severe cases, from simple daily activities like bending over or coughing. The most common complications of advanced osteoporosis are fractures, particularly in the spine, hip, and wrist. Spinal fractures can lead to serious changes in posture, severe back pain, and a reduction in height. Hip fractures are particularly concerning as they often require surgery and can lead to significant disability and even an increased risk of death within the first year after the injury. Wrist fractures, while generally less debilitating, can still interfere significantly with daily activities. These fractures can profoundly affect a person's mobility and independence, leading to further health complications like deep vein thrombosis and pulmonary embolism due to prolonged immobility. Diagnosis of osteoporosis is primarily achieved through a bone density test, also known as a dual-energy X-ray absorptiometry (DEXA) scan. This test measures the grams of calcium and other bone minerals packed into a segment of bone, providing a snapshot of bone health and density. The results are compared to the bone density of a healthy young adult and are given as a T-score. A T-score of -1.0 or above is considered normal. Between -1.0 and -2.5 indicates low bone mass, osteopenia, and -2.5 or lower suggests osteoporosis. The DEXA scan is quick, non-invasive, and the most commonly used method to diagnose osteoporosis. It is typically recommended for all women over the age of 65 and for younger women at increased risk of osteoporosis due to factors such as early menopause, a family history of osteoporosis, or use of medications that can weaken bones. Besides the DEXA scan, other tests might be used to assess bone health or investigate underlying causes of bone loss. These include blood and urine tests to measure levels of calcium, vitamin D, and markers of bone metabolism, which can provide insight into bone turnover rates and the presence of other metabolic disorders affecting bone density. In some cases, a spine or hip X-ray may be recommended if a fracture is suspected. These additional tests help provide a comprehensive understanding of an individual's bone health and are crucial in planning an effective treatment and management strategy for osteoporosis. Preventing and managing osteoporosis involves a multifaceted approach, focusing on diet, exercise, lifestyle choices, and when necessary, medication. A diet rich in calcium and vitamin D is crucial for bone health. Calcium is essential for maintaining the strength of bones, and vitamin D is necessary for the absorption of calcium from the diet. Foods high in calcium include dairy products like milk, yogurt, and cheese, as well as leafy green vegetables such as broccoli and kale, and fortified foods like orange juice and cereals. For vitamin D, while exposure to sunlight is a primary source, dietary sources like fatty fish, salmon mackerel, egg yolks, and fortified foods also contribute significantly. Exercise is another pillar of osteoporosis prevention and management. Weight-bearing exercises, such as walking, jogging, and climbing stairs, help build and maintain bone density. Muscle-strengthening exercises, like weight training, can also be beneficial. Additionally, activities that improve balance and coordination, such as yoga or Tai Chi, can help prevent falls, thus reducing the risk of fractures. Lifestyle modifications play a crucial role as well. Quitting smoking and reducing alcohol consumption are vital, as smoking can decrease bone mass and alcohol can interfere with the body's ability to absorb calcium. Lastly, various medications are available that can help prevent bone loss and reduce the risk of fractures. These include bisphosphonates, the most commonly prescribed drugs for osteoporosis, as well as newer medications like denosumab, which can be used for those who cannot take bisphosphonates. Hormone-related therapies may also be recommended for certain individuals. It's important to consult with a healthcare provider to determine the most appropriate treatment based on individual risk factors and bone density findings. Living with osteoporosis requires thoughtful adjustments to daily life to manage health effectively and prevent injuries. As women age, one of the most critical aspects is fall prevention, as falls are a leading cause of fractures in individuals with osteoporosis. Simple home modifications can make a significant difference. These include securing rugs, installing grab bars in bathrooms, improving lighting, and organizing living spaces to keep frequently used items within easy reach. Wearing supportive footwear and using assistive devices like canes or walkers, if needed, also contribute to stability and safety. Regular exercises that enhance balance and strength are equally important to minimize the risk of falls. Support systems play a crucial role in coping with the psychological and physical challenges of osteoporosis. Joining support groups where experiences and strategies are shared can provide emotional comfort and practical tips, Counseling may also help individuals navigate the emotional stress that often accompanies a diagnosis of osteoporosis. Regular medical checkups are essential to monitor the progress of the condition and adjust treatment plans as needed. These checkups can include repeat bone density tests to assess the effectiveness of treatments or modifications to lifestyle and medication. By adhering to treatment plans and maintaining a proactive approach to health management, individuals with osteoporosis can lead active and fulfilling lives. If you think you might be at risk for osteoporosis, it is strongly encouraged that you consider getting screened. Early detection through bone density tests can be a game changer in managing and even preventing serious complications. Alongside screening, adopting a healthier lifestyle is crucial. This includes eating a diet rich in calcium and vitamin D, engaging in regular weight-bearing and muscle-strengthening exercises, and avoiding smoking and excessive alcohol consumption. These changes not only improve your bone health, but also enhance your overall well-being. And remember, you're not alone in this journey. Please share your experiences or any tips you might have about managing osteoporosis in the comments below. Your story could inspire and help others facing similar challenges. Let's support each other and build a community focused on stronger bones and healthier lives. Today, we've explored the crucial aspects of osteoporosis, particularly its impact on women, from understanding what it is and recognizing the risk factors to identifying symptoms and discussing effective strategies for diagnosis, prevention, and management. We've covered the importance of dietary choices rich in calcium and vitamin D, the benefits of regular physical activity, and the need for lifestyle modifications to enhance bone health. Remember, while osteoporosis is a serious condition, it doesn't have to define your life. With the right approaches to prevention and management, it's entirely possible to live a full, active, and healthy life, even with osteoporosis. Stay informed, stay proactive about your health, and maintain regular checkups to keep your bones strong and your body resilient. Let's embrace these challenges with hope and determination. If you found this video helpful, please consider subscribing to our channel